Hello everyone, welcome back to my YouTube channel. So today's topic of the video is important question of Pharmacology 3, that is in semester 6 of BPharmacy according to the PCI syllabus. We'll start with unit number 1, which consists of anti-asthmatic drugs. So asthma is a condition in which there is constriction of your bronchi and it leads to hypoxia, dyspnea and other conditions wherein oxygen supply is reduced and you're not able to breathe. The most commonly used anti-asthmatic drugs are bronchodilators, and in bronchodilators specifically beta 2 receptor agonist, anticholinergic drugs, and some theophylline like methylxanthines are widely used. Besides, you get certain metered dosage inhalers, powdered dose inhalers of corticosteroids, either for systemic use or for inhaled use, like dexamethasone, hydrocortisone, so they can be also used in asthmatic condition. Other monoclonal antibody for asthma condition is omalizumab, that is a anti-IgE antibody, and few other miscellaneous drugs for asthma are mast cell stabilizer, that is sodium chromoglycate and ketotifen, and other are leukotriene antagonist, that is montelukast and zafirlukast. So basically their mechanism of action also differ. Like mast cell stabilizer usually prevent the degranulation of mast cell. So if there is no degranulation, there will be no release of inflammatory mediators. And if there is no release of inflammatory mediators, asthmatic condition won't arise at all. Leukotriene antagonists are basically lipooxygenase inhibitors, and they also inhibit release of inflammatory mediators, but not by inhibiting degranulation. Instead, they are directly prevent the release of these inflammatory mediators. The bronchodilators simply increase the CAMP level, that is cyclic adenosine monophosphate, by either increasing adenyl cyclase, which converts, we'll see this via a small cycle. There is GTP. GTP gets converted into cGMP, and cGMP gets converted into GMP. This conversion of GTP to cGMP is aided by guanylate cyclase and adenylate cyclase, depending upon if it's ATP or if it is GTP. And this conversion of CAMP into 5-GMP is aided by phosphodiesterase enzyme. So either increasing GC will increase the amount of cGMP, or either decreasing phosphodiesterase will indirectly increase the amount of cGMP. And that is the main aim, to increase the amount of cGMP levels in the body. Corticosteroids are not bronchodilators, but yes, they give relief from the asthmatic condition. Drugs used for COPD, I have mentioned it because they run concurrently with anti-asthmatic drugs, and just like the omalizumab acts, it prevents the IgE antibody. It prevents the antigen antibody interaction, and it decreases the binding affinity of this IgE antibody. So it would be better that there is no release of inflammatory mediators, there is no asthmatic condition. So decreasing the binding affinity will also aid in managing the asthmatic condition. Next is respiratory stimulants. This is a topic that could be asked for 5 marks or so, and they are also called as analeptics. So they could easily directly describe analeptics and give the example of few analeptics. So you don't have to get confused, because there are two terms, nasal decongestant and analeptics. Analeptics are basically used whenever there is a respiratory depression. Nasal decongestants are used whenever you have a congestion in your nasal cavity, and that is mainly because there is dilation of the vessels, and nasal decongestants basically cause constriction of the vessels, so there is easy decongestion of the mucus and other toxic substances. Next, we have unit number 2, wherein we have appetite stimulants and appetite suppressants. They are basically also called as appetizers or exogenous agents or anti-saltatory. or satiated, depending upon which term you are using. If it's suppressant, then they are a feeling of satiation, and if they are appetite stimulants, then anti-satiatory. Antiemetics are mostly used because motion sickness, morning sickness, mountain sickness, vertigo, these are a few of the problems that one experiences either during traveling or whenever they're in the sea, on the mountain, or they're experiencing vertigo. So antiemetics basically include few type categories of drugs, out of which few are prokinetics, anticholinergic. Prokinetics are further divided into three types, that is mixed, 5-HT4 agonist, D2 receptor blocker, and antipsychotic drugs. Certain antipsychotic drugs are also useful as antiemetics. Emetics are basically drugs that promote vomiting. So emetics include apomorphine, ipecacuanha syrup. So those are examples of emetics. Speaking about 5-HT3 receptor antagonists, most widely used are ondansetron. Even the syrup comes for kids. It's available in tablet formulation as well. Granisetron, ondansetron, ramosetron, these are examples of 5-HT3 antagonists because they block the serotonin receptors. Next, we have prokinetics. Prokinetics are basically increasing the LES contraction, that is the lower esophageal sphincter contraction. That is due to release of acetylcholine, and that is due to release of vagal stimulation. Antipsychotics are basically including chlorpromazine, haloperidol, etc. In mixed, we have metoclopramide. That is the second most widely used drug, metoclopramide. 5-HT4 agonist, we have cisapride and mosapride. And in D2 blocker, the one prominent D2 blocker is used, that is called as domperidone. So that is a domperidone. That is also quite beneficial. Next, we have anti-ulcer drugs. In anti-ulcer, we mostly have to study about the four diseases in which the drugs are commonly used. Those are GERD, that is gastroesophageal reflux disease; ZES, that is Zollinger-Ellison syndrome; PUD, that is peptic ulcer disease; other inflammatory conditions; and one more, that is aspiration pneumonia. Aspiration pneumonia. So the drugs used are basically for these disorders, and the classification includes H2 antagonist, that is famotidine, cimetidine, ranitidine, nizatidine, roxatidine; PPI, that is the most widely used, PAN 20, PAN 40, And examples are omeprazole, pantoprazole, rabiprazole, lansoprazole, S-omeprazole. Antacids were first used, but now their use is quite less in anti-ulcer category. But antacids of mainly two types, systemic and non-systemic. Non-systemic include magnesium hydroxide, aluminium hydroxide, that is milk. Magnesium hydroxide is also known as milk of magnesia. And then we, in the systemic one, we have sodium bicarbonate, sodium citrate, etc. They are examples of antacids that are systemically active. Next, we have anti-ulcer drugs as well, that are antibiotics mainly. They include amoxicillin, which is a penicillin which belongs to a beta-lactam antibiotic. Clarithromycin, which is a macrolide. Tetracyclines, mostly oxytetracycline or doxycycline are being used. These are the few antibiotics. And then we have ulcer healing and ulcer protective agents. That is, they form a film and they protect the skin mucous membrane from erosion. They include CBS, that is colloidal bismuth substrate, and they include sucralfate. They are most commonly used ulcer protective agents. We also have few anticholinergic drugs like pyrenzapine, oxyphenonium that can be used in treatment of ulcer, and they are again quite useful for ulcer healing and treatment. So that's all for unit number 2. Speaking about unit 3, the first and most important question is chemotherapy of antihelmetic drugs. So antihelmetic drugs are basically those drugs that help in reducing the worms inside the body, either luminal or intestinal. And there are few most important drugs that you have to study in antihelmetics. Mainly diethyl carbamazine is a very important drug. Praziquantel is an important drug. Niclosamide, ivermectin, thiabendazole, mebendazole. These are few of the drugs that are useful in killing the worms, and their use depends upon the kind of worm you're infected with. Like there could be roundworms, there could be tapeworms, there could be lukeworms. So the use of these drugs is dependent upon the which is the kind of infected worm you have been affected with. The next is antiviral or antiretroviral drugs. Basically, it includes furthermore three categories, that is anti-herpes, anti-influenza, and antiretroviral. So in herpes, basically most commonly used drugs are acyclovir, ganciclovir, and in influenza, the most widely used is amantadine, remantadine. But in antiretroviral, there are few categories that you need to remember thoroughly. That mainly includes NNRTI, NRTI, protease inhibitor, and integrase inhibitor. So NRTI stands for nucleoside reverse transcriptase inhibitor. NNRTI stands for non-nucleoside reverse transcriptase inhibitor. Protease is an enzyme that is involved in the host cell and the bacteria and the viral cell for its replication. And integrase is an enzyme that is useful for incorporation of the viral DNA into the host DNA. So in AIDS, we all know that the virus responsible is human immunodeficiency virus, that is HIV, and it is a STD, sexually transmitted disorder. It can be STD as well. And the most impactful thing that about this virus is that it can affect your immune system and it can affect your CD4 cells, that is the T lymphocytes. So your body is not able to produce corresponding antibodies. And certain drugs are used in combinations so that we can encounter these problems. Foltigravil is a most commonly used integrase inhibitor. Speaking about nucleoside reverse transcriptase inhibitor, you have zudevudine, lamivudine, Zidovudine is also known as azithromycin because it is very, very vital. And another drug is didenosine. And in non-nucleoside reverse transcriptase inhibitor, you have loviride, desloviride, that are that they are called as non-nucleoside because they are non-competitive and are reversible. But NRTI are competitive and usually irreversible because they have a similar structure as that of nucleotides. But non-nucleoside reverse transcriptase inhibitors do not have a similar structure as nucleoside. So we can study this with the help of an example. Consider that this is a site of action, okay, and we prepare. You can consider a lock and key. To a specific lock, there is only a particular key. You cannot just insert any key and open that lock. So if we insert a similar key to that lock, we call it as nucleoside reverse transcriptase inhibitor because it is similar looking and it is also getting attached in the lock. But if you change the shape of the lock, if you just make any few changes in the key and alter or mute or modify its shape, so that will be a non-nucleoside reverse transcriptase inhibitor. Next is anti-tubercular drugs, which is caused by microorganism Mycobacterium tuberculosis. And you can study this via a mnemonic that is PRIZE. P stands for pyrazinamide, R stands for rifampicin, I stands for isoniazid, S stands for streptomycin, and E stands for ethionamide. And usually the DOTS therapy, which is the most important therapy for tuberculosis, because its medication lasts for 3 to 4 and even much more months if it's chronic. So this combination of these drugs is usually given, and these are the first line agents of tuberculosis. There are other drugs as well, like capreomycin, kanamycin, ethambutol, PASA, that is the para-amino salicylic acid. So these drugs have multiple mechanism of action that you have to study, either by inhibiting mycolic acid synthesis, either by inhibiting fatty acid synthesis, or simply the DNA, the involvement of dihydropteroate and dihydrofolate reductase. So these are few of the mechanism of action of these tubercular drugs. And the last is anti-malarial drugs. These are very important because it is caused by a protozoa, that is Plasmodium vivax. And there are other species as well, like Plasmodium falciparum, Plasmodium malariae, that Plasmodium ovale, that causes malaria. And malaria is the classification mainly includes 4 aminoquinolones, 8 aminoquinolones. Then you have just naphthoquinones, and the amidioquinone is an example of a naphthoquinone, atovaquinone, chloroquine, primaquine. So you have to study which drug acts on which stage of the malaria, because there are two hosts in malaria. First, the Plasmodium vivax and the human host, we can say, or a vector, and then the infected female anopheles, that when it bites on the human, it further forms merozoids, trophozoites in the liver and salivary glands. So you have to know about the different stages like exoerythrocytic stage, gametocytic state, sporozoid state, and which drug acts on which state. So this stage is very important because many a times in GPAT the question has been asked that give an example of a drug that acts on the exoerythrocytic stage. So all the anti-malarial drugs would be given, but there would be only one specific drug that would act on that particular stage, that is the exoerythrocytic stage. So you have to remember that. That's all from unit 3. Next we have unit number 4, in which you have to study about monoclonal antibodies. Monoclonal antibodies are basically produced by a fusion. It is a hybridoma technology, of which one is the myeloma cells, that is the cancerous cells, and one is the plasma cells. These plasma cells helps in producing antibodies. And why do we choose myeloma cells? Because myeloma cells have ability to reproduce, to multiplicate this antibodies at a very faster rate, just like a cancer. In a cancer stage, a particular cell divides rapidly, and then it spreads quickly. Similarly, a myeloma cells quickly helps in multiplicating of these antibodies so that it can help in faster replication and better reproducibility. Next, we have immunosuppressants that comes under immunopharmacology. There are certain drugs like leflunomide, sulfasalazine, hydroxychloroquine, corticosteroids, azathioprine, which is the most widely used anti-cancer drug as a purine anti-metabolite. So these are few of the drugs that are used as immunosuppressants, and you have to study about them, that how they modulate the immune system. Now you would be thinking, why would one use immunosuppressant? A basic use is whenever there is an organ transplant or whenever there is an organ failure and there's an immediate need to incorporate a new organ. That time we use immunosuppressants that slows down your immune system so that your body has greater acceptability to the new organ. That is what is immunosuppressants mainly used for. And next is chemotherapy of STD, that is sexually transmitted diseases, and it can be also asked via another name, that is venereal diseases. They mainly include genital herpes, gonorrhea, syphilis, and AIDS, of course. Gonorrhea is caused by Neisseria gonorrhea. Syphilis is caused by Treponema pallidum, in which there are various chanceroids are formed, and there are lesions. Either it can be in prostate or gonococcal or vulvovaginitis. It depends upon the organ which is affected. But these STDs, it is very important that you know about the drugs, either for AIDS or for gonorrhea. Next, we have unit number 5, in which we have to study about the treatment of poisoning. Poisoning is basically whenever there is a poisoning, there are few methods that are implemented to eradicate the poisoning or to manage the poisoning, but it cannot completely detox that poisoning. First of all is we give an emetic. Emetic is basically something that will help you cause vomiting. So whatever you have consumed, you are able to throw it out. That is emetic. Next is cathartic. A cathartic is a strong laxative. We all have heard about isabgol. That is a bulk forming laxative that helps in increasing the stools. So a stronger version of that laxative is cathartic, so that whatever you have consumed, if it's in the body, it can be easily eliminated from the stools. Next is a oxygen therapy or a plasmapheresis, in which we supply oxygen for the immediate therapy because there might be apnea or something. Another most widely used agent is activated charcoal. Many a times in the face wash and face mask, you would have seen that there is activated charcoal. Why is it used? Because it absorbs all the tan, all the dust and material that is present on your face into that particular formulation, and so that you look more brighter. Similarly, whatever toxic substances, whatever poison you have taken, this charcoal will absorb that poison into your body so that it's no more available in your bloodstream and it can be easily eliminated. And these are few mostly used methods during the poisoning. And another is a miscellaneous method wherein you give drugs, and depending upon the type of poisoning, the drugs are given. Like if it is a poisoning due to cholinergic drugs, so an anticholinergic drugs will be given, or a pralidoxime chloride will be given, or atropine would be given in that case. And similarly, if it is any poisoning that is a benzodiazepine poisoning or a alcohol poisoning, so we use different drugs like flumazenil, fomepizole during these poisoning. Some mostly used agents in arsenic, lead, that these are heavy metals. That is why we say that cosmetics are not to be used much, because cosmetics mainly contain heavy metals that are cancerous, carcinogenic. So applying more of makeup or more of extreme amount of heavy metals on the skin may lead to carcinogenic properties. Arsenic and lead are basically treated by D-penicillamine and disodium EDTA. Disodium EDTA is a hexadentate ligand, and we can just study its mechanism of action via a small example. If there is a rat, what do you do to trap a rat? You set up that chip that traps the rat, and you set up a piece of cheese. So as soon as rat comes in that cheese, it would be trapped in that particular trapper. Similarly, there would be a poison, and disodium EDTA will trap that poison within itself by forming a complex. It will not allow it to enter into your blood, so it will become less poisonous, and then it can be easily eliminated out via body. And D-penicillamine is also used as in the treatment of poisoning. And at the last we have biological clock and chronotherapy. Chronotherapy is basically your sleep wake cycle or circadian rhythm, you can say. So whenever we say that we have a particular habit of sleeping at 11 or 11:30 or 10, so that is via release of certain hormones like melatonin. So melatonin, that is formed from a precursor of serotonin. So whenever it's 10:30 or 11, no matter whatever and how much interesting or whatever you might be doing, but your melatonin and your clock genes will be activated, and they will force you to sleep at that time only. And many a times, if you are not able to sleep at that time, we face a problem that many a times we even complain that yaar neend nahi aa rahi hai, this and that. So that is the reason, because your time of sleeping is being disturbed. There is a particular wake up cycle and a sleep cycle. Just like your digestive rhythm, there is three concepts in Ayurveda, that is Vata, Pitta and Kapha. Vata is activated from 6 to 10 in the morning, Pitta is activated from 10 to 2, and Kapha is activated from 2 to 6, and the same goes on in the night. So whenever there is certain these parameters go on, there is a particular cycle that moves on. So similarly, the chronotherapy deals with the sleep and wake cycle, and that is called as a biological clock. That is the reason you feel sleepy when there's an ordinary time of sleeping. So that's all for today's video. If you liked my video, please do like, share and subscribe, and comment in the comment section what do you want me to upload next. Thank you so much.